Vincent, we know antibiotics and antivirals have saved millions of lives worldwide, but these drugs are now losing their effectiveness. It's called anti-microbial resistance. Health experts warn it could push 28 million people into poverty by 2050. And it's high on the agenda as world leaders meet in New York this week. VOA's Lenore Madu reports.
This week in New York, the United Nations General Assembly will address the growing threat of antimicrobial resistance. Medical experts say infections such as pneumonia, tuberculosis and HIV are becoming harder to treat as the antibiotics and other medicines used to treat them become less effective. Antimicrobial resistance is a global issue affecting both humans and animals. Dr. Keiji Fukuda, Assistant Director General and Special Representative for Antimicrobial Resistance with the World Health Organization, says it is due to several factors, including
maybe we push the doctor and we say, look, my child is really sick or my parent is really sick, you have to give an antibiotic. And when that person has an illness which doesn't need an antibiotic, we are contributing to antibiotic resistance. Or if we are raising animals and the animals are not sick, we're giving antibiotics to help them grow, then we are promoting antibiotic resistance. When we have people who are not qualified give medicines, or we have people who take medicines from anywhere, we are often contributing to the development of resistance.
Antibiotic resistance causes people to be sick for longer and increases the risk of death. The World Health Organization says in 2013 there were about 480,000 new cases of multi-drug-resistant tuberculosis. Antibiotic resistance kills about 23,000 people each year in the United States, 25,000 in Europe, and many more in developing countries.
You know, in Africa today, infectious diseases remain a major killer of children, of women, of adults, and one of the key ways to protect people is to have antibiotics that work. So if the infections in Africa become increasingly resistant, as they are in every part of the world, then it's going to become harder and harder to treat infections in Africa. So very big problem.
Dr. Fukuda says addressing the issue is critical as more people may die globally of antimicrobial resistance than of cancer by the year 2050.
We need to address this issue on several different levels. So at the global level, the regional level, at the country level, but then in communities. You know, we have to get to communities, we have to get to farmers, we have to get to families, we have to be in rural areas, cities. All of those levels have to contribute.
In May this year, the World Health Assembly agreed to support an action plan, which includes committing the 194 countries that make up the Assembly to producing national control plans by 2017. Observers hope this week's high-level meeting at the UN General Assembly will lead to concrete global action. Lenore Madu, VOA News.